Welcome back to the Roots podcast presented by Elite Anesthesia. Today we've got Dr. Sean Keller from Smiles by Design with us. Welcome, Dr. Keller. We're excited to chat with you.
Oh, glad to be here, Sean.
We've also got James Prince with us. He's our chief here in Seattle.
Yeah, man, this is great. This is meant to happen right here, so I'm excited about this podcast.
Dr. Keller, how long have you been working with Elite?
It's been 3 years now. 2 years, 3 years.
Almost 2 years.
Yeah.
Yeah, almost 2 years.
2 years, going on 3.
Yeah.
Nice.
Time flies.
Yeah.
Yeah.
Changes the game for me. I love working with James and the rest of the crew there.
Yeah, man.
It's just so much easier of a day when we use Elite.
Yeah.
Dude, and it's literally some of my most fun days, man. Like, everything from the moment first of all, his energy matches mine, man. Like, he shows up, he's pumped, man. Like, he's got that huge smile. He walks in looking like Wolverine, you know what I'm saying? And like, yeah,
I feel like we should do this podcast standing up.
I know, right? Like, his music's out.
Dude,
we were jamming out Michael Jackson the other day.
I've been known to cut a little rug. Yeah, no, we have a lot of fun in there, and I feel like I super loosen up when I have the patient's under anesthesia, and I'm not responsible for it. For many, many years, I would use Halcyon, Benadryl, or Halcyon, and
just
nitrous.
Oral sedation.
And I mean, for all full mouth implant procedures, it's the only reason to do it is because you're trying to be cheap, and I think it costs you a lot more in the long run.
Yeah.
Like the little bit that Elite charges for that is more than worth it for the quality of care that you can give, how much less stressful it is. I mean, I flat out do a way better job, and I'm going to have less problems with the case later if the patient's not moving and I'm not sitting there trying to watch the vitals. I mean, it's safer, better care, and ultimately it's cheaper because I'm not paying to redo an implant later or redo a suture. And I'm more productive because I finish so much faster.
Yeah.
Every now and then there's a case that I do where for some reason it's it's a little bit less cost on the case. I'm like, oh man, I don't know if I can afford to add this, and the patient's financing it, and this is the most they can get, so I'm doing it for that. And I'm thinking maybe I won't use Elite on this one, and I almost always regret it. I can tell you on those days I'm not singing and dancing during the case then because I'm dealing with the disadvantage of oral sedation.
Yeah.
Could
you well, we want to talk to you about your practice, but could you, while we're on the topic, could you get into a little bit of the economics maybe of, I mean, what does that mean if you have a patient that maybe has to come back a few times? Like, how does that affect the patient economically and maybe from like a perception standpoint?
What is it when you charge a patient for a big case like this? Like, what does an all-in-X cost? Is it 15 an arch, 20 an arch, 25 an arch, 30 an arch, 35 an arch? I've seen it all over the place.
Right.
And I usually tell my patients implants have a 98% success rate for life if you don't load them and it's a single implant and you do it perfectly. When you start immediately loading them, that's going to drop to 95% if you do it perfectly. That's 1 out of 20 is going to fail. If you're doing a 6-on-6 case, that's almost every other patient's going to have a failed implant on that. Now, what's going to happen if that person's coughing and moving around and starting towards the Halcyon works for an hour and a half, 2 hours before they're starting to get to that agitated state, and if you give them another one, it makes it worse. So, and I know a double arch takes a lot longer than that if you're doing it right.
Yeah.
And those people you're going to not be as good, and that failure rate is going to go from every other patient to almost every patient. And sometimes, if you did 4 to 6 implants, if one of them fails, it doesn't mean the whole case failed, but that's a whole nother day where you have to do that. And these people they're traumatized. They've already had probably one set of dentistry fail in their mouth before, and this is their last shot. Like, their teeth have failed them. They probably had crowns fail them. They've had root canals failed. They probably had an implant fail. And now they're getting this, and if you have one of these fail, it's really traumatic for them. Persons, they're less likely to refer another case. I mean, you do this right for somebody. When we do it right and we take great care of somebody and it just goes perfectly, they're going to send you everyone they know that needs this.
Yeah.
Right.
Like birds of a feather flock together.
Right.
Yeah.
And they have friends that need this, and if you take great care of them, they'll take great care of you back.
Yeah.
And
No, it's super good insight. The reason I ask, I feel like dentistry in general is kind of in this transition period where a lot of our general dentist population is moving into the surgical world. And anesthesia is a hot topic because it's expensive. And you do have some options to be able to do it on your own. I think that a lot of dentists are just kind of stuck in the middle trying to decide how to economically make it work and is it worth it. I think those who are using us would say that it is. So it's good to hear your feedback on
It's
that.
worth it, and when you have, sometimes when you guys just have the patient pay for it separately, they kind of get it.
Yeah.
You know, and for smaller procedures, it's less. Like, it's an hourly thing, and it's not that much. So,
Yeah.
I mean, to me, it's less than it used to be, too.
Yeah.
It's less expensive, and to me, it's worth it. You finish faster, and it's done, and the peace of mind. Like, I can walk in there, do it, and I walk out, and the whole rest of the day, I'm productive. I can do my consults. I'm fresh, and I can do my consults and exams, and more than make up for the cost that I spent on it, because I'm not stressed out and wiped out.
Yeah.
And I feel like I can work a lot longer in the week because I'm not wiped out from dealing with everything.
Interestingly, on that same topic, so oral surgeons is a whole nother category of discussion we don't need to get into, but in Utah, we originally, so we've been in business since 2020, a little bit of pushback from the oral surgeon community, having us come in and work with them because they do the same thing. They do their own anesthesia, and you understand it well.
Oh yeah.
And fast forward a couple years later, and we actually have the entire board of oral surgeons in Utah, works with us in some capacity.
Right.
And that's the recurring theme is, for somebody super well trained in anesthesia, like an oral surgeon, they do that often, and so there are some cases that don't stress them out. But even in the routine stuff, the patient population is getting sicker.
For sure.
It's getting heavier.
More
It's getting more
complex.
difficult to deal with.
Yeah.
Smoking more weed.
Yep.
You name it. There are a lot of reasons why patients are getting harder to sedate. And just interestingly, 3 years down the road, we're working literally with every oral surgeon on the board in Utah.
I mean, James and I did a case 3 weeks ago, and the patient's health history, she didn't tell us some of the recreational drugs that she'd been taking. Turns out later there was some fentanyl. I think we found out meth too, and some other things that they weren't telling us. And when he had
They often don't.
So that's the thing people don't realize too, is like, this is a true chronic condition, right? Like, if these people could tell you the truth, they would, but they can't. So they've kind of, had to do whatever they had to do to support their condition, and often it involves lying. And it's crazy, as much as I want them to be honest with me because I'm giving them anesthesia, they still can't be. And often they're using a lot more than they realize. And man, when she showed up, I mean, I don't know. Have you ever seen me sweat before? Like, just getting the IV in.
I mean, I could say cool and calm under pressure. It was tough, and then at some point, like, her vein didn't do everything we hoped it would, and I'm halfway done with the procedure. But it was nice knowing I had you there to just handle that.
Yeah.
And you did like a rock star, so I could focus on the teeth, and I had an implant to do. It was porcelain case, but we took great care of her. But I think that could have gone the other way without you there.
Absolutely.
And you don't need, as a general dentist, we're held to the same standard as oral surgeons and periodontists for implant work that we do. And you don't need to have a case, 1 or 2 cases go the wrong way, and you won't be doing those big cases anymore.
Absolutely.
Right? And you need to be dialed in and focused on the dentistry that you're doing and not worried about this stuff.
Absolutely.
The vitals and the anesthesia and everything else. So I can worry about the teeth, and you can worry about keeping them alive.
And Dr. Keller does everything. Like, I mean, I think what's really cool about his practice is he's called us in for some of these big implant, like, big cases, but he's also called us in for some general dentistry cases. He kind of sees everything from beginning to end, and we've worked together just on some really complex cases, some really complex patients, man. And, on that crazy case that he just spoke of, dude, he stayed there the entire time. He stayed there during the entire recovery. I knew it was going to take us a long time to wake her up because she had such a significant
we drove her to the hotel.
Put her down.
Yeah, man. And he was there for an hour and a half, like, just with me, sitting at her bedside, recovering her. We were talking to her, making sure she was comfortable. Like, it took her a while to come out of anesthesia, but I think it says something about the care that he has for the patients, knowing they're complex, that he kind of sees it all the way through the end.
Yeah, I mean it's awesome work, and I feel the care from you too. Like you won't stay until you're comfortable that they're ready to go.
Yeah.
The kind of, I mean, how I evolved to giving the kind of care that we do. I like to think we're known as when the person's told they don't have any bone and this case can't be done for them. That's my favorite ones is where they've been seeing multiple implant surgeons and they just say nope, and we're like, no, we can do this. You know, with my Orca training in Guatemala and the learning with Rick Klein and Alex Fedoshenko down in Australia and Aparicio in Barcelona, these residencies we've done, we can do the quadzygoma, the transnasal, the vomer, the pterygoids.
Yeah, we did it the other day.
Yeah, and it's
You're here for the hard stuff.
yeah, like it's awesome when somebody walks in and they just have a mile of bone and you can put 4 implants spread really wide, but most of my ones are little eggshell bone and you're trying to find remote anchorage in places.
Yeah.
And you don't want to be putting an implant right here or 2 of them right here on each side with that person moving at all.
Yeah.
Like
Yeah,
that,
it's a
like,
precise.
and that's you just want it to be perfect and precise, and you need to have elite anesthesia to do that. And to be honest, like, even when I get one of these simple cases, I don't want it to turn into one of those cases 10, 15 years from now. And so even my simple cases, I'm trying to over-engineer it so that it's just done one time and done one time right.
Yeah.
And that's why it's nice to have Elite for that.
Yeah. That's amazing feedback.
Dude,
It's hard for us to. And not everyone understands, you know. It's I think the economic piece is a big part of it. And just trying to get through that.
I mean, the patient, healing is better when they haven't been hacking and coughing and moving and stressed out. They're going to heal better too.
Yeah.
They're not going to have as much bruising. It's going to be even if they don't remember it from the halcyon, it's like their subconscious does.
Yeah,
Yes,
for sure.
we talk about it a lot actually with nerve blocks.
Oh yeah.
Yeah, we call it a ramp up, where if your sympathetic nervous system or any pain response is mitigated from the beginning, you're actually able to control that easier for a longer period of time. So just keeping that at bay from the start is actually really, really helpful.
Yeah.
Did you have another anesthesia group that you were using and then you switched to oral sedation? Like, how did that happen?
I had a anesthesia guy that I worked with a couple times. He was the awesome guy, brother, anesthesiologist.
Okay.
It was really expensive though. I mean, it was he was actually anesthesiologist. It was awesome to work with him, but it was like $7,000 or more, or 8 or 9 every time I used it. And when you're trying to save the patient every dollar you can, I mean, I would say it was still worth it for the ones I did it on, but at the end of that, that's just a lot of cost. And with more and more dentists doing these procedures and them playing, I want to be known as more the Nordstrom's that does this. Like, I don't want to be using the cheapest implant. I don't want to be known as the guy that's using the cheapest implant that's out there. Like, why is it the cheapest? Like, why are there better ones out there? Absolutely, there are.
Right.
There's ones that actually gain. If you use the Morse taper connection, it'll actually gain a little bit of bone over time instead of slowly losing it. So to me, this is kind of like your don't buy the cheapest parachute that you can find. Right? Like, this is your last shot at your teeth. You want quality. I want somebody. I want the patient to hold still, and I'd rather if there's a place that does anesthesia as well as you guys do, and to me it's a good cost. Then I can spend the extra money on better parts and doing it the right way. You know, better final teeth, better implants, all the parts that I use. I'm not trying to use the cheapest stuff that's out there. I want to use the best.
Yeah.
I love that.
And it leaves me the room to do that when I'm not dropping $9,000 on anesthesia.
Yeah. Gotta be competitive. So let's get into your practice a little bit, and let's kind of start from the beginning. Where did you grow up?
So I was born in Seattle and grew up in Kirkland to start.
Right here, man.
Yeah, like
Homegrown.
literally the house I was born in is literally a block from my house right now. I didn't even know that. Yeah, I didn't even know that till my sister Michelle was showing her the practice. Like, look at the building I got. Like, it's gonna be meant to be the implant center. Upstairs is gonna be the lab. Downstairs will be the clinic. And she's like, the house we were born in? And we walked around, and it was, like, right there.
Really?
The house is gone, but same yard. I recognize the tree, a little bigger now.
Huh.
You can see where the rope used to be for the tire swing.
Shout out.
That's cool.
But then we kind of outgrew it. My went to Holy Family Catholic School, which is right up on the hill there by Lake Washington Tech.
Was that like secondary school, like
Just
high school?
Catholic grade school.
Yeah.
And then sixth grade, I think my parents had their sixth kid then, and so we were just kind of outgrowing the house there. So my dad had this beach cabin up on Camino Island, so we move up there, and it's tiny little room, and they had 3 more kids up there. So we had at one point we had like triple bunk beds in one room.
Oh,
Jeez.
snap.
Yeah,
And 9
it was
kids.
like all of us up there.
Where are you at?
Number 2. Second
2.
oldest. 4 boys, 5 girls.
Sheesh.
Our next door neighbor is Dr. Bolender. He was the head of the prosthodontic department at UW.
Oh.
And I'd say we didn't make a good impression on him. Some of the stuff that we pulled out there, just with 4 boys, the battles that we'd have that would spill out into the yard and out onto the beach.
Dude, you'd be so proud now.
I dressed up as Santa Claus one year and came out, and we told all the kids to look outside. So I'm running across his roof so they could see it out there, and I slipped and fell and land on his wood pile and came out, and I thought I broke my back, and I'm out there screaming, and the kids are crying because they're like, Santa Claus just died. We saw him fall. And I come in later, oh God, can you take me to the hospital? So yeah, there was a hospital trip about once a week with that many kids there. But anyway, it was fun growing up with the brothers, and then went up to Western for undergrad. I was a carpenter.
Weston's in Bellevue?
Bellingham.
Bellingham.
Okay.
Sorry.
Yeah.
We're in Bellevue.
Yeah, way up north, almost
Yeah.
up by the border of
I had a
Canada.
nephew that went there.
Yeah, it's a good school. My older sister went there too. And then got into dental school. I was probably a carpenter for about 10 years, like all growing up from all through high school and through going to Western. Yeah, so went to then I went to dental school. I remember Dr. Bolender coming out, and he was telling me from what he knew about us and how rambunctious we were. I was like, yeah, I think I want to get into dental school. And he was like, have a backup plan. Aim lower.
Don't tarnish my profession.
And I was like,
What-
oh man. So like, but that kind of like drove me to study a little harder. So got into UW, went to dental school there, graduated, and man, right when I got out of school, that's when I worked. I didn't have any dentists in the family, so I signed up for a temp agency, and was doing like random jobs. It was you wake up and they say, okay, you're driving to Pullman today. There's a dentist went down there, so you're gonna go work there. So for like 3 months, I just kind of drove around
everywhere.
the state. Yeah. And sometimes I do hygiene jobs. There's whatever it took to meet people and get busy. And then what happened? I wound up working for Gentle Dental in Everett for a little
Okay.
bit, and great people up there, and kind of let me know that I didn't want to do general dentistry. You know, when you work in the corporate world, they had like these numbers they had to meet, and
Yeah.
everything was insurance based. So I know how to do these beautiful crowns, and your insurance plan will cover a silver filling, so that's what you're doing today, and you have to use this type of amalgam. And I'm just like, I just like being told what to do and how to do it was
How to
really
treat
tough for
people.
me.
Yeah.
Yeah, and so I wanted to buy my own practice, and then 9/11 happened. Yeah, and I remember that morning waking up, sitting there on the couch, and even if you guys remember that.
Oh yeah, I think everybody remembers.
I was in grade school, but I do remember.
Oh yeah, you're young, dude. I was in college.
I mean, remember we first my brother Bo, also dentist, yeah, and then my other brother Andy's also a dentist, like
All
my
here?
younger ones.
Yeah, they're all
they're
here.
here, and then my other brother, yeah, they all
Should have
like,
had them all on together.
he was still
Oh,
in
that'd
dental
be
school,
nuts.
yeah. So he's getting ready to get into dental school, and he's my roommate. The 3 of us live together, and we're just watching the news, and we see the first plane hits it. Like I wake up and it's already happened, and they're just like, it's an accident. What a random accident! And we're watching the news live, and then the second one hits, and
Yeah.
we're just like, that's
Whoa.
not an accident.
Yeah.
And that's before they cut it too, and you were seeing
Yeah,
people
everything.
fall. Yeah, I was nuts seeing
Yeah.
that. So, but the economic effect is all these dentists that were about to sell their practices because they thought they would retire weren't anymore.
Yeah.
So nothing was for sale. There was like one practice that was any worth looking at that was for sale, and it was Smiles by Design in Redmond Town Center. And most practices you see that one was insanely expensive. It was over $1 million, which back in 2001 is
25
crazy.
years ago.
Yeah, that's not, most of them were selling for 2 or 3, And I just looked at it and I was like, wow, like it's the only one for sale. But I remember seeing it had like blue neon lights in the sterilization room, and I walked in there and it was just the most posh, coolest place I'd ever seen. And the Dr. Rossi and Dr. Olson were two instructors at the Las Vegas Institute for Advanced Dental Studies, and it was just big cosmetic practice, all veneers and neuromuscular dentistry, like the facial changes on people after you do their teeth was insane to me, because I'd done silver fillings and PFM crowns before.
Oh, interesting.
You know, kind of what they taught at UW, and root canals, and it was insane to see this practice like that. And I looked at it, and they were like, you got to come in and like just come. I'll pay you a week to work here just to see what it's like. And I was like, all right, I got nothing to lose. I'll try it out. And I fell in love with the place. And eventually I was able to get a loan for it. And to me, it was insane. My dad was against it.
Yeah.
My accountant was against it.
Yeah.
But
Went against
You
the
saw
grain.
the vision?
Yeah.
yeah, and I got to admit, even after I got it, I found it hard to believe some of the things that they were saying, like the whole idea with neuromuscular dentistry, like the idea that you could put a computer on somebody and measure their muscles and relax them and have the jaw position change, and then the way that you build the veneers and the teeth to get rid of headaches and migraines. That was insane to me that would work. And I honestly didn't believe it. I was like, get out of here and I'll do just some veneers and the occasional implant, maybe the crown. I couldn't wait to get their equipment out of there after I bought it, but they stuck around for another year and kind of taught me how to do it. And then I started going to LVI and lived it, breathed it, saw it, and it works. I believe it. And so that got me into just doing these kind of bigger, comprehensive cases where you look at a lot more than just the teeth.
Yeah.
And it was, I attended LVI. I went through the whole program twice because it was just
So good.
fascinating to me. Yeah.
Oh, that's cool.
Yeah, and it cost me 10 times what dental school did going to it.
Of course it did.
And then my brother graduated and joined me, so kind of doing that together, and that was fun.
So he joined you at Smiles by Design?
Yeah.
Okay.
Yeah, and that was fun working with them for a while. Eventually, he kind of thought, like, I don't want to work with Big Brother. I got to do my own thing.
Yeah,
so
yeah.
kind of do it, and it's
Good
been
for
fun
him.
too. Yeah.
Yeah.
So we all got the little want to do our own thing in us a little bit.
Yep.
And then my other brother Andy graduated, and he's doing it now too. And Brett is like a master lab technician, so he knows how to do. He actually does the work that we install. So that's kind of cool having him do that.
It's a full family practice.
Yeah. So I realized with these big porcelain, big reconstructive cases, if people have had this bad bite and things are hitting the wrong way for long enough, they start losing teeth. And sometimes a bridge is appropriate, but sometimes you can't. And so I kind of got into implants, but with this holistic approach that we do, the titanium implants weren't always the best choice. And I've been hearing about these non-metal implants, like the zirconia implants coming out of Spain and Switzerland. And so I think the internet was just coming out around then too. Like I remember downloading, it's like 2002, getting an email about this ceramic implant, and I'm sitting there waiting for it to download. As the picture's going, the whole thing's white, I think. Is it going to be gray at the bottom? And the whole thing's white. Wow, it's zirconia. Like I was like, yes. Like white implants. We don't have to have that gray metal in there.
Yeah.
But I remember the email downloading so slow. Was that early internet?
Windows 98?
It was
Dial up, man.
Yeah, so the email came in, and then I emailed the guy back, and he's like, I said, can you send me some? And it's like, obviously you can't use them, they're not FDA approved yet, but you can play with them a little bit. So got a few of them, and as soon as they got FDA approved, I had the first shipment coming in, and so started placing these white zirconia implants, and they're freaking awesome, man. Like to me. I usually don't use them for the big, crazy full arch cases because that remote anchorage stuff, they can't make them long enough to go back there. Yeah. But if you're missing a single tooth, they're awesome. Yeah. So kind of got into the implant world. And
Who makes those?
There's a few of them. Back then it was Ceraroot, but now there's Straumann bought the Noble. They have the Noble Pearl one, they call them, but they were called Z System before that.
Okay.
That
sounds familiar.
Yeah, there's like 4 of them now. There's even one trying to do it where they do a CAT scan of a molar, and then they get an STL file from that So it's actually shaped exactly like the tooth, and they mill that, and you pull the tooth, and then you tap one that's already shaped like that into the spot,
right in there.
like
Wow.
that's shaped exactly like the tooth was. Yeah, so that they're doing those in Switzerland right now, called Implant. They want me to donate money so they can get FDA approved. Apparently, getting FDA approved it's more about just getting $1 million together.
Just pay for it.
Pay some, yeah.
You just buy
So
it.
they're just trying to. We just got to get enough money to go.
Sounds
so we can
right.
get approved. Oh.
So you bought Smiles by Design, and you didn't inherit. You bought this practice, went to Las Vegas Institute. Is that right?
Yeah, and it's kind of it was known as like there weren't a lot of cosmetic schools out there like back then. Like now, veneers you can watch a
Everywhere.
YouTube video.
Yeah.
You know, everybody's got a video or a school on it. But back then, veneers weren't really that popular or a thing.
Yeah.
And so there was maybe them and Pankey and the Hornbrook Institute, a couple of them around the country. But that to me that was the best one. Like I actually had an institute. It wasn't some guy's practice with a
Right.
room on the side.
Yeah.
Right.
And it was Vegas too.
Yeah.
So who doesn't want to go there for your
Yeah.
weekend?
Yeah.
And maybe that's why I had to take the school twice because
You're only there half the time.
no, it was buying Smiles by Design and being able to hang out with two of the instructors there, Dr. Rossi and Dr. Olson, was life changing for me. I would have not believed some of the stuff that they were doing there, like some of the pictures they had on their wall as you walk through the practice of the facial changes, like somebody with like a receded chin and a weak chin, and it looked like they had like a class 3 jaw surgery to fix it. But I went and looked at them. All they had was the back teeth redone in porcelain to bring it in the right spot. So as your teeth wear down, then it kind of pushes your jaw back, and then your jaw muscles bulge out, and the digastric gets overworked. But when you tens the jaw and put the EMGs on there and read it and get it in the right spot, we do it with an orthotic first, and then once it's there, then we build it up with porcelain. And I mean, it was just watching them do it again and again and again and again, and then seeing 7-8 years of patients who had been through this and hearing their story, like, oh, I was getting migraines and neck pain and breaking teeth all the time, and these guys put in the orthotic and restored me, and I've been good for 7-8 years. Just the testimony, I was like, wow, I gotta figure this out. And so that I started doing it and built my way up, and
So
now
the practice was doing that, and then were you guys replacing implants as well, and then did it have a general dentistry component also, or was it like purely cosmetic?
I mean, to me it was that is general dentistry now.
Yeah.
I guess like when
Yeah.
somebody comes in and they've got a bunch of plastic fillings everywhere, I can't help but look at everything else you see going on. Like if if they get one cavity, I guess the less you know, the more normal your patients appear.
Mm-hmm.
And so if they, almost nobody has a perfect bite in the way things fit. So if somebody, people don't come to me because they have a cavity.
Yeah.
They usually come, I'm getting headaches, migraines, or I'm missing teeth.
Mm-hmm.
And my goal is not to just slam one. If you're missing a tooth and the tooth on each side has collapsed into it and the top tooth has come down, just placing an implant in there is not going to fix that. Like now the whole jaw has shifted from that, and you're going to need an implant every 2-3 years the rest of your life, or a root canal, or you're going to lose bone and cause periodontal disease from the way the bite is. So I'm looking at, yes, maybe you do need an implant there, but we got to get your jaw in the right spot and build everything the right way it was.
The big
And
picture.
when you start knowing more and asking more, I notice that you're missing a tooth right there, but I look at your cone beam scan, and that joint is impacted, and it's clicking. Do you get headaches very often or migraines? Yeah, I've been able to think about it more of like a sinus headache like this. Does the lateral pterygoid attach to the back of your sphenoid bone, which could cause a sinus headache there? And do you get pain coming down right here? Yeah. Are these fingers a little numb? Yeah. So let's, before we do that, while this implant's healing, why don't we just throw an orthotic in there and put that joint in the right spot and see if some of that gets better? And so that kind of led to that. And as I met more and more complex cases that needed more and more implants, then this all on X thing started to come out, because I'd meet people that needed, there were enough bad teeth that they either needed a denture or an implant retained denture. And so, but I still didn't really use anesthesia that much yet.
Yeah.
Okay.
You know, for like a full mouth, but it was not. I would say there were hard days.
Yeah.
Yeah, the days where I was.
What years were these?
Like 2000, and as I kind of watched them and helped them and did the more general type stuff in 2001 through 3 and 4. But as I started, my veneer cases got bigger and turned into full mouth cases, and started placing implants. Well, it was like 2002 to the implants, but it's usually just 1 or 2. So I try to just survive off the oral sedation then. But by about 2007 or 8 is when I started getting into the more complex ones, and that's when I started using the anesthesiologist. But it was just so expensive. That was a big hang up for me then.
Yeah.
Yeah.
And there's only one of them.
Yeah, there's like not many.
Yeah.
That's why you can charge so much, right? When
it was insanely expensive then. But I mean, it was nice to not have to think about it. But you're always trying to provide the best possible experience and safety for your patient. And how can you argue that it's not a better experience and safer for the patient to have somebody else taking care of the vitals and doing that?
Yeah.
It's like these complex cases. They're hard.
They're real surgeries.
Yeah.
Yeah. It's not like you're flopping. There's nerves. There's bone. There's sinuses. It's a human right there, and having more people that know what they're doing a part of that. When you look at like a cardiac surgery, there 8 people around there doing
right.
that, and we're working on these all-in-X cases. You've got their face open.
We've said it a few times that these oral surgery cases, all-in-X cases, are some of the craziest surgeries that I've ever been a part of.
Yeah.
They're 4 to 6, even 8 hours long. There's a lot of blood. There's a lot of teeth. There's a lot of bone. There's a lot of.
I mean, when you're doing like a femur replacement, they use general for that.
Oh yeah.
Yeah.
And you don't. There's
You
not
get a
an
toenail
airway
removed
right
and
there.
you're getting general.
The brain's far away from it. There's not an airway right there.
Yeah.
Yeah.
You don't see what it looks like afterwards.
Yeah.
With this, you're gonna see it. And then there's you're not packing sugar around it and seeing how that acts. But this, the next day they're gonna be, drinking sugary things, and that's gonna affect the infection rates.
Yeah.
So
It feels like as dentistry moves, we kind of talked about it earlier, but as dentistry moves and is transitioning into more of a surgical world than it's been in the past, anesthesia is just an absolutely necessary part of that. And there's some drag and everyone being able to adopt it or being willing to adopt it. There's also not been a lot of availability of the anesthesia itself. I mean, we've been around for 5 years as a company. We've been here for a little less than 2.
Yep.
I mean, we're adding providers at a rapid rate right now, trying to keep up with demand. So it's just interesting to see dentistry as a whole evolving into that world, and I think it's created a lot of trauma throughout the years of patients who probably should have been sedated but didn't have the opportunity to be, and and a lot of surgeries that could have had better outcomes if the patient was asleep.
Couldn't agree more, Sean. And not to bring up when things do go wrong, but I've heard stories about dentists having losing their license over that one case that goes bad.
Yeah.
And this is a pretty major surgery, and I can guarantee you when that does happen to somebody, the chances of that happening are a lot less when you have somebody else taking care of this part, somebody who's trained, dialed in, and that's all they're looking at. And I've worked with you on a ton of cases, and I mean, I'd trust you with my life from what I've seen.
Absolutely.
What you do. Like if I knew I had to go under, I'd feel totally comfortable with you looking at my vitals for whatever I had done.
Absolutely. And I mean, I think that's the biggest thing,
Get
man.
that ketamine in there.
Yeah.
Start with that.
I'm joking.
What we fail to realize is that the experience does matter. Like everything from the moment we walk in, how we return, all that stuff matters, man. And I think one of the biggest reasons why dental anxiety is what it is because there was a time before anesthesia, and then there's now. And then one of the biggest reasons why I went into anesthesia is because I got my wisdom teeth out under local. And I remember asking him, like, what's the anesthetic plan? And he was like, we're just going to numb you up and hold you down. And I was like, wait, that's the plan? Like, that's legit the plan? And they were like, yeah, I'll just be as fast as I can. And I remember feeling everything, and I heard the drill, and I felt like the pressure, and I saw him, he had the hammer, and he was like cracking my tooth, and when I left, it changed me. Like, I was immediately more fearful. And the result of that shows the pathway of why people have full-blown mouth implants, because I got a cavity, I don't know, maybe a year later, and I didn't tell my mom. And I started having all this cold sensitivity, and I didn't say anything. And I didn't say anything because I didn't want to go back to the dentist. And I was like, maybe I'll just go away. I'm just take some Tylenol, like, you know, da-da-da. And then it turned into a root canal. And when I went back to my general dentist, she was like, why didn't you say anything? And I was like, dude, I was so fearful. Like, I thought that was going to happen again. And she was like, oh my gosh, I'm so sorry. So like one thing can lead to the next. And you can see where anesthesia can come in and really play a pivotal role as far as just making the experience more palatable. I think one of the cool parts about your practice is you've created this tool belt. And I think when all they have is the all-on-4 solution, then that's what they offer, because that's what they have. But you kind of have this holistic approach where you can look and treat in many different directions, and you'll offer that accordingly, man. And I love that. Like, that's the type of practice that I'd want to send my mom to.
I can't tell you how many people. I've got a lady right now that just came in and she said, I'm done with my teeth, right? Like, they've betrayed me and I want them out, and I'm ready for this all on 4, all on X, whatever it is. And I've convinced her that that's not, she's got a bite problem, and that's what's wrecking the teeth. And I think we can do 3 implants in the back and restore it with porcelain and keep her teeth. It's what I would do in my mouth. And I believe, well, she goes, well, what if I spend all this money on this and then I need this in 10 years anyway? I'm like, I'll give you the guarantee on this. As long as I'm practicing, you know, I'm gonna manage this. I believe that strongly in this, right? That this is gonna last for you. That the problem is, you shouldn't, you know, there is a time when people do need the implants.
Yeah.
And if there's 4 or 5 teeth left and they're in really bad shape, yeah, don't try to hang on to, you know, a lonely island out there in the middle. But there's a lot of this. I think this procedure is done too often. I think many times it's a bite issue and an implant here, an implant there, and build up the back teeth in a strong way. We have some really cool ways to get the jaw in the right spot, and I think you'll get 10, 20, 30 more years out of your teeth the way you could with very little problems. And who knows what technology we'll have in 2 decades. To me, it's like, and so a lot of these all on 4 cases, the way they hit, it's going to slowly cause a little bit of a forward head posture, and possibly even the digastric. I mean, I'm aiming for optimum facial changes as we do this. And I noticed that when I put EMGs on the muscles, if I leave it high in the premolar area, the masseters bulge out. And even the digastric is kind of tensing right here, and that's where the double chin look can come from, is that muscle. But as soon as I get hitting them on first and second molar, these muscles relax and start to thin out. Your jawline and cheekbone over the year will start to look more prominent, and this will suck up as you're hitting on your molars. All on 4s can't hit there. Is that a problem? Yes, but in some people, can they have implants back that far? That big sinus, and there's no bone, and the nerve is close on the bottom. It's hard to say. You know, with the advent of new materials in sinus lifting, or the pterygoid implant, or sometimes if there's a molar there, we can get one in the palatal root. I'm doing everything I can to get those back implants. I want to over-engineer every case. I'm not just trying to get 4 implants and a set of 12 teeth in there. I want the back as solid as I can so I can get the jaw in the right spot, open the airway, support the face, support the joints, and straighten their spine up. It's interesting being in the TMJ world. We know that if the jaw goes off, that throws the neck out. That'll throw your shoulder girdle out and your hip girdle, and this can affect the whole body. Yeah. And so I'm
just hearing you describe that. I mean, it's pretty intricate, the surgery in and of itself, and to hear the implications of making sure that procedure is done well, is pretty extensive. All the way down to back.
I get fired up about it now.
Dude, I love that.
Yeah, and I mean, to bring this back full circle, but I can't even imagine trying to do something that precise on a moving target.
Oh, absolutely. And the more I saw a couple of gray hairs in my beard a couple of weeks ago, and either I'm getting older or I'm a wizard. And I know I'm not getting any older, so as I get older, the energy to to do one of these cases when they're not sedated. It's not good for your heart. It's not good for your back. Like I want to get in there on a, I would say on a upper lower 6-on-6 implant case. If I'm trying to do oral on that, that's going to be 6+ hours, no matter what.
Yeah.
With Elite Anesthesia, I mean, it's going to be 90 minutes for the top and probably 60 for the bottom.
Yeah.
Wow.
Yeah.
Almost cut in half.
Yeah. And it's
Dude,
just-
and it's cool too, man. I think one of the things I actually love working with is like providers that have been there kind of since the beginning. Like this dude, he's one of the first in Seattle to start doing implants. Like everybody kind of knows Dr. Keller. So he's kind of seen just the change. And I remember one day I left my power cord for my monitor in his surgical room, and he had just started using Elite Anesthesia, so he wasn't fully using us yet. And I stopped back the next day, and he was doing a procedure, and I walked in, and he was like, "Thank God you're here." And I was like, "Oh no, I'm just here to pick up my power cord." And he was like, "Oh my God, we need you so much." Like something like, you know. And he immediately had that appreciation, man. Like, dude, I actually, and his staff is the same way. They're like, "Dude, we love when you're here." And I was like, "Dude, I love being here." And he's like, "All right, we're gonna start calling you more often." And we've been working with him even more and more ever since. But it's kind of cool to have that juxtaposition where you've literally seen both sides of it, and that appreciation's there, man. It's great working with you, and they always are able to handle themselves well because they've been working on moving patients for so long that when they get a steel patient, man, they're able to do some really precise work and work super fast. And I remember he was able to do a consult one day, and he's like, "I've never been able to do a consult on a surgical day."
On a surgical day.
And he was,
my general way that I used to do it, I can't remember one of these practice management places to teach you how to run a good business and take better care of your patients. And it says, get your work done in the morning, and then put on your tie and your nice outfit for the afternoon to meet people, and you can get in that emotional state. But if I do one of those cases in the morning and I got a consult or two in the afternoon, I'm a different man. If like your chances of connecting with somebody who's about to have their teeth taken out, how's that gonna go when you're wiped? You're not gonna be able to connect with them and have them feel comfortable with you. But somebody who used Elite comes in there fresh, they can sit there and connect with this patient, actually have a chance to help them understand to get the care that they need. They need if they're in there, they need this. And if you're not at the top of your game, then you're not going to be able to you're going to miss something, or you're going to blow they might say something that was hard on them, and you're not going to be able to help them feel better about that if you're wiped out. It makes a huge difference.
It's awesome to
hear.
hear.
Guys more.
I love it.
I was laughing thinking about some of the cases of when I've had associates over the years, and some of the and using oral sedation. It's you never know how with oral how it's going to act. Sometimes it doesn't seem to do anything. You give them 2 pills and it's been an hour and a half. All right, can I give them another one? All right, it's been an hour and a half. Let's do one more.
It's a beauty IV.
What are you doing in the meantime? Like while you're waiting for it to kick in, or you just kind of burning the candle?
No,
until...
I'll usually I'm just kind of sitting in there in the room, like you got to keep an eye on them during that. So I'll be sitting in there just kind of looking at the vitals and doing notes, looking at the case. But after an hour and a half, and then it's time to start. The part they're gonna remember the most is probably the numbing. And so we use the wand and a lot of topical and the wand, and I'll use some endo ice to kind of cool the area before I numb it. But sometimes they'll still remember that part. It's not. There's times when I've done oral and you ask them to say, "Hey, how much do you remember from yesterday?" Everything.
Oh wow.
And is that person gonna send you everyone they know? After even you can do the most amazing job, the most amazing veneers that just looks so natural. I spend top dollar on the lab, and I spend a lot of times on the provisionals, making sure they're perfect. And you can do everything perfect, but if their memory is that was tough, they're not going to want to send.
It's
people.
not a good experience for them.
Yeah,
and
if you're going to do complete dentistry, that's not a half-hour filling. It's a long time to sit in the chair, and I'm reminded every time I have to sit in the chair. I remember,
dude,
if I have to get it my back was really tight. What are you gonna say?
No, I chipped my tooth the other day, and I called you, and I was like, "Oh man, what was I doing? Oh man, I bit down onto the fork." And like I had already knocked it out a little bit from like mountain biking, and I bit down and I was like, Dr. Keller, I was like, dude, I chipped my tooth. And he was like, yeah. And he was like, all right, man, like I'm out of town this weekend or something. I was like, oh man, like, and immediately I was like, man, is this gonna hurt? Like, I was kind of already thinking about, like, you know, man, do I need sedation? Should I call my buddy? Yeah, like, should I call my buddy? Yeah, like.
I remember saying that Chip probably looks good. You're a good-looking guy. Chip probably looks good. Like, you probably look
tougher.
badass.
He
Like,
told me I look tougher.
Probably look tougher, man. Like, watch that. The kids will listen to you now. You're
Just
like,
leave it.
I've been through some stuff.
Forks.
I asked my wife, I was like, do I look tougher? She's like, you look like an idiot. And I was like, okay, never mind.
I got in a fight, and he caught me with his Super Bowl ring right there.
Well, Dr. Keller, it's been awesome. Great conversation. James Prince, thanks for listening.